everyone. Today I'm going to teach you the basics of ECG, exactly the way I explain it to my medical students. This topic may feel difficult at first, but if you understand this foundation, cardiology will become much easier to approach. Let's start with the normal ECG. A normal ECG consists of three main components: the P wave, the QRS complex, and the T wave. To understand these waves, we first need to review the basic anatomy of the heart. This is the right atrium, right ventricle. This is the left atrium and left ventricle. Here is a sinoatrial node, and here is a atrioventricular node. Electrical signals start from the sinoatrial node, spread through the atria, pass through the atrioventricular node, and then propagate into the ventricle through the conduction system. This classical conduction pathway diagram is useful, but today I want to simplify it. This is a sinoatrial node, and this one is a atrioventricular node. These are the bundle branches and Purkinje fibers. And here is the atrium area. This large one is the ventricle area. I often use this simple schematic because it helps us understand ECG, heart motion, pressure changes, and valve movement together. Let's look at the cardiac cycle using this schematic. First, the atria contract. This atrial contraction corresponds to the P wave. Next, electrical signals pass through the AV nodule. This delay is represented by the PR interval, and it allows enough time for the ventricle to fill before they contract. Then electrical signals spread into the ventricles. This is a ventricular depolarization, and it corresponds to the QRS complex. Immediately after depolarization, the ventricle contracts mechanically. Then the ventricle begins to relax. This recovery phase is called repolarization, and it corresponds to the T wave. Although the T wave represents electrical repolarization, mechanical contraction continues slightly beyond it. After repolarization is completed, the heart returns to its resting state, and the cycle starts again. Now let's connect ECG waves with cardiac phases. The systolic phase is a period of ventricular contraction. It starts at the QRS complex and ends near the end of the T wave. After that comes the diastolic phase, when the ventricles relax and gradually fill with blood from the atria. Now you learned the concept of ECG waves and cardiac phases relationship. Next, let's talk about pressure changes, which are frequently tested in exams and clinical practice. First, left atrial pressure. At rest, systolic phase, left atrial pressure is low, usually under 10 mm of mercury. It becomes highest at the end of diastole because atrial contraction has just occurred. During systole, left atrial pressure becomes low again. Now, left ventricular pressure. During diastole, left ventricular pressure is low, allowing blood to flow easily from the left atrial into the ventricle. During systole, left ventricular pressure rises rapidly, reaches its peak, and then quickly falls at the end of the systole. Finally, aortic pressure. Aortic pressure is typically around 120/70 mm of mercury. During systole, it rises sharply because a large volume of blood is ejected from the left ventricle into the aorta. Before moving on, I want you to focus on just two pressure relationships. If you understand these 2 points, you can draw the pressure curves by yourself. First, during diastole, blood flows from the left atrium into the left ventricle. That means left atrial pressure is higher than left ventricular pressure. Second, during systole, blood is ejected from the left ventricle into the aorta. That means left ventricular pressure is higher than aortic pressure. You don't need to memorize the diagram. If you remember these two relationships, you can reconstruct the entire pressure curve from scratch. Being able to draw it by yourself means you truly understand the physiology. Now let's connect pressure change with valve motion. Immediately after the onset of the QRS complex, left ventricular pressure rises and the mitral valve closes. This closure produces the first heart sound, S1. When left ventricular pressure exceeds aortic pressure, the aortic valve opens and blood is ejected into the aorta. At the end of systole, aortic pressure becomes higher than left ventricular pressure, leading to aortic valve closure. This produces the second heart sound. After that, the ventricular pressure continues to fall. When left ventricular pressure becomes lower than left atrial pressure, the mitral valve opens and ventricular filling begins. When you look at pressure curves, always compare left atrium and left ventricle, or left ventricle and aorta. From these relationships, you can easily predict when valves open and close. What we discussed today is essentially a simplified regress diagram, integrating ECG waves, pressure changes, heart sounds, and mechanical heart motion. This area is often confusing, but it is one of the most fundamental concepts in cardiology. If you understand this well, you will be able to understand many other cardiac diseases, ECG patterns, and hemodynamic problems much more easily. Whenever you feel confused, go back to the basics. Stay calm and act first. See you in the next video.